A hiatal hernia occurs when part of the stomach pushes up through the diaphragm and into the chest. For some people, it causes no trouble at all, while for others, it leads to notable discomfort and health concerns. In this video, we will walk through 10 important signs and symptoms of a hiatal hernia that you should know. Recognizing these clues can help you decide when it is time to speak with a healthcare professional. You may feel you already understand what a hiatal hernia feels like, yet it can be misleading. Many of its signals are mistaken for milder problems, such as simple indigestion or heartburn. Stay with us as we reveal the unexpected ways a hiatal hernia can show up. 10. Vomiting of blood or passing black stools. Melena. Vomiting blood known as hematemesis and passing black tar, like stools known as melena, are urgent warning signs in people with a hiatal hernia and warrant immediate medical care. These findings point to bleeding in the upper digestive tract, most often the esophagus or stomach, where prolonged acid exposure has damaged the protective lining and produced erosions or ulcers. The appearance of blood and vomit can vary. Bright red suggests active brisk bleeding, while a dark coffee ground look indicates that blood has been partially digested by stomach acid. Even small streaks or specks should be taken seriously, as they may signal ongoing tissue injury that can escalate without prompt treatment. Black tarry stools arise when blood from higher in the gastrointestinal tract is digested as it travels through the intestines. The iron in red blood cells darkens after contact with gastric acid, and enzymes creating the classic inky color and a distinctive foul odor that differs from usual bowel movements. In the setting of a hiatal hernia, bleeding most often stems from complications of chronic reflux, including esophagitis, esophageal ulcers, or erosive injury to the portion of the stomach that has migrated through the diaphragm. In more severe situations, the herniated segment can become strangulated, cutting off its blood supply and causing tissue death with bleeding. Uncontrolled blood loss can lead to anemia and significant symptoms. People may develop weakness, fatigue, lightheadedness, or even fainting as their hemoglobin falls. Slow, unrecognized bleeding can progress unnoticed until anemia becomes severe, which is why any sign of upper gastrointestinal bleeding should prompt a medical evaluation without delay. 9. Shortness of breath. Shortness of breath, or dyspnea, can arise in people with a hiatal hernia through several related pathways tied to the shifted position of the stomach. When the hernia is large, part of the stomach occupies space in the chest that normally belongs to the lungs, squeezing lung tissue and trimming usable capacity. Breathing may feel shallow or incomplete, particularly during exertion or while lying flat. Many describe an inability to take a full, satisfying breath, or a sense of not getting enough air, even when oxygen levels are normal. This sensation can be unsettling and may provoke anxiety, which in turn amplifies the effort of breathing. Body position plays a major role. Reclining flat often worsens symptoms because gravity allows more of the stomach to slide into the chest, increasing pressure on the lungs. Elevating the upper body, sleeping on a wedge pillow, or resting in a recliner commonly eases the load by pulling the herniated portion back toward the abdomen and restoring some breathing room. Acid-related airway irritation offers another explanation for dyspnea in these patients. When reflux stomach contents reach the throat and upper airway, they can inflame the lining, provoke bronchospasm, and stimulate excess mucus production. The result may resemble asthma with coughing, wheezing, and breathlessness. These respiratory symptoms often intensify after eating, when a fuller stomach is more prone to herniate upward and reflux is more likely. Meals themselves can influence comfort. Large portions in foods that promote bloating, increase abdominal pressure, encourage further herniation, and heighten compression of the lungs, making breathing feel harder. Many people find that switching to smaller, more frequent meals reduces post-meal breathlessness and helps maintain steadier respiratory comfort throughout the day. 8. Hoarseness or sore throat. Persistent hoarseness and throat soreness in people with a hiatal hernia often stem from gastric acid reaching the larynx and vocal cords during reflux. The larynx houses the cords that create your voice, and these delicate structures become inflamed when exposed to acid. This pattern, known as laryngopharyngeal reflux or silent reflux, may occur without the classic burning of heartburn. Voice changes usually creep in over time, and are frequently most noticeable upon waking after a night spent lying flat. Many describe a raspy, scratchy, or weakened voice and find themselves clearing their throat repeatedly to speak comfortably. The throat symptoms extend beyond the voice. Individuals commonly report a lingering sore throat, the sensation of a lump or something stuck, and a near constant urge to clear mucus. Dryness, irritation, and inflammation are typical, and some develop a chronic cough as the body tries to expel acid that has reached the upper airway. When symptoms occur, offers helpful clues. Morning worsening suggests that reflux reached the throat overnight in the horizontal position. Others notice flare-ups after meals or with acidic foods and beverages that boost acid production. Ongoing exposure can lead to complications such as inflamed vocal cords, ulcerations in the throat, and a higher likelihood of respiratory infections. Some people develop chronic sinusitis or post-nasal drip because reflux can affect the entire upper airway. In more severe situations, long-term acid contact may raise the risk of throat cancer, underscoring the importance of proper evaluation and treatment. 7. Bloating and belching. In people with a hiatal hernia, changes in stomach position disrupt normal gas movement and digestion, so air and gastric gases can become trapped in the herniated segment. This leads to a tense balloon, like abdominal distension, that many describe as feeling as though their stomach is filled with air. Because anatomy is altered, the usual pathway for releasing that gas is impaired, so it does not vent as easily through belching. The sensation often emerges during a meal or shortly afterward and can linger for hours. Patients commonly report a tight, stretched feeling or an uncomfortable fullness of air. The swelling may be visible with the abdomen looking distended and waistbands fitting more snugly than usual. Excessive belching, medically termed eructation, often follows as the body attempts to relieve pressure. However, in the setting of a hiatal hernia, belching frequently provides only limited relief because the displaced structures make gas escape inefficient. Many find themselves belching repeatedly without much improvement. Gas buildup has several sources. Air swallowed while eating or drinking is more easily trapped in the portion of the stomach that is moved upward. In addition, altered anatomy can slow gastric emptying, giving bacteria more time to ferment food and generate gas. Certain foods and beverages commonly amplify these symptoms. Carbonated drinks introduce extra gas that can become stuck in the herniated area, and naturally gas-producing items, beans, cruciferous vegetables, and high-fiber foods may provoke more pronounced bloating and belching than they would in people with normal anatomy. Over time, many patients learn to identify their personal triggers and limit them to reduce discomfort. 6. Feeling full quickly. Early satiety. Early satiety describes becoming full after only a few bites, well before a typical meal would satisfy hunger. In people with a hiatal hernia, this happens because the portion of the stomach that has slipped upward loses space and normal flexibility. With less room to expand, the stomach sends "I'm full" signals to the brain much earlier than it should. This sensation is different from the comfortable fullness that follows a complete meal. Many report feeling uncomfortably stuffed within minutes of starting to eat, or after only small amounts, which can be unsettling for those who previously finished regular portions without difficulty. Anatomically, the stomach segment that is herniated can be pinched by the opening in the diaphragm, effectively shrinking usable capacity. That constriction can also blunt gastric accommodation, the stomach's natural ability to relax and stretch as food arrives. On top of that, altered positioning may slow the emptying of food into the intestine, so contents linger longer than normal. Over time, early satiety can lead to unintended weight loss and gaps in nutrition when daily calories and essential nutrients fall short. Some adapt by switching to smaller, more frequent meals, which can help. Others still find it hard to keep up with their needs despite these changes. The intensity often fluctuates, with some days much worse than others. Triggers can include particular foods, psychological stress, or shifts in how the herniated portion sits. Many notice that liquids go down more easily than solids, and they may lean on smoothies, soups, and oral nutrition supplements to maintain intake when solid meals are poorly tolerated. 5. Chest or upper abdominal pain. Pain in the chest tied to a hiatal hernia can be alarming because it often mirrors heart-related discomfort, prompting worries about cardiac disease. The ache is commonly felt beneath the sternum, directly behind the breastbone, and it may spread toward the back, the shoulders, or even the arms. This pattern occurs because the esophagus and the heart share overlapping nerve pathways, which blurs the distinction between esophageal and cardiac sources of pain. How the pain feels varies widely from person to person. Some report a burning quality, others describe sharp stabbing jabs, and many experience a heavy pressure-like sensation. It may remain steady or arrive in waves, and the intensity ranges from mild annoyance to severe pain that disrupts daily routines. Discomfort in the upper abdomen. Epigastric pain often appears alongside chest symptoms. This soreness sits just below the rib cage in the midline and arises when the portion of the stomach that has shifted upward and becomes compressed within the chest, leading to pressure and inflammation of nearby tissues. Timing and triggers offer useful clues. Symptoms typically intensify after eating, especially following large portions or meals that include known trigger items. Activities that raise intra-abdominal pressure, bending, forward, lifting, straining commonly make the pain worse. Many people notice relief when they sit upright, and antacids frequently ease the discomfort. 4. Difficulty swallowing, dysphagia. Dysphagia, medical shorthand for trouble swallowing, can develop in people with a hiatal hernia when the shifted stomach changes the normal pathway for food. The portion of the stomach that has moved upward may create pressure or a partial blockage, making each swallow feel awkward or incomplete. This often creeps in slowly and may first show up with specific textures or types of food. Many describe the sensation that food is sticking somewhere behind the breastbone or high in the throat. When that feeling appears without actual food, it is called globus sensation, and it can make meals feel stressful. The stuck sensation can last a few seconds to several minutes, and people often reach for water to help push material down into the stomach. The pattern of swallowing difficulty can hint at severity. Early on, solids are the usual culprits, especially dry, dense items like bread meat or even tablets. If the problem advances softer foods, and eventually liquids may also become hard to move along, suggesting increasing anatomical disruption or related complications. Intermittent symptoms are common with stretches of normal eating punctuated by sudden episodes of difficulty. Triggers can include stress, certain foods, or eating too fast. The emotional toll is significant. Anxiety around meals may reduce overall intake and contribute to nutrient shortfalls. Some people start avoiding shared meals out of embarrassment or fear of choking, which can undermine quality of life and strain social connections. 3. Regurgitation. Regurgitation is distinct from vomiting. It refers to the effortless return of recently swallowed food or liquid into the mouth without the forceful abdominal contractions that characterize vomiting. In people with a hiatal hernia, the shifted position of the stomach disrupts normal flow and weakens the lower esophageal sphincter, making it easier for material to move backward. What comes up typically tastes sour and acidic, and it may include recognizable pieces of food eaten moments earlier. Unlike bile-tinged vomit that originates deeper in the digestive tract, regurgitated material usually rises from the upper stomach or lower esophagus, so the flavor is a mix of acid and the lingering taste of the recent meal. Episodes can be unpredictable and embarrassing, sometimes appearing suddenly during conversation, laughter, or routine activities. Many people begin to notice patterns and can anticipate regurgitation after certain foods with particular body positions or during actions that act as personal triggers. The amount that returns can vary widely. Small volumes may slide back into the throat and be swallowed again, while larger amounts may need to be spit out. When regurgitation happens often, the repeated acid exposure can erode tooth enamel and contribute to dental problems. It may also irritate the throat and lead to hoarseness due to ongoing contact with acidic stomach contents. 2. Acid reflux. Acid reflux refers to the backward movement of stomach contents into the esophagus when the lower esophageal sphincter loses its normal barrier function. In people with a hiatal hernia, the portion of the stomach that has slipped upward alters anatomy and pressure dynamics, weakening this valve and setting the stage for repeated backflow. The result is a cluster of unpleasant sensations that many find hard to ignore. A common complaint is a sour, bitter, or even metallic taste that suddenly appears in the mouth. This taste reflects real gastric acid and partially digested food rising up the esophagus and reaching the throat. Hydrochloric acid carries a distinctly harsh flavor that can provoke nausea or queasiness. These reflux bursts can strike at almost any time. They may interrupt a meal appear shortly after eating, or wake a person from sleep with a foul taste coating the back of the mouth. Nighttime episodes are particularly troublesome because while lying down, acid can linger against the esophageal lining for longer periods and cause more irritation. Certain movements and efforts increase the risk. Bending forwards, hoisting heavy items, or doing core exercises that raise abdominal pressure can push acid upward. Even routine tasks like tying shoelaces or picking something off the floor may be enough to provoke a surge. How often reflux occurs varies widely. Some people notice occasional flare-ups, while others endure multiple episodes each day. When acid exposure becomes frequent and prolonged complications can follow, including inflammation of the esophagus ulcer formation, and in more severe cases, precancerous changes known as Barrett's esophagus. 1. Heartburn. Heartburn is the hallmark and most frequent complaint in people with a hiatal hernia. The sensation usually sits behind the breastbone, in the retrosternal area, often climbing toward the throat, and many describe it as a spreading burn through the chest. This feeling arises when gastric acid slips past a weakened lower esophageal sphincter and bathes the delicate lining of the esophagus. Unlike the stomach, the esophageal mucosa lacks a robust protective barrier, so acid exposure readily irritates it and produces the classic burning pain we label as heartburn. Timing is a major clue. Discomfort commonly intensifies about 30 minutes to 2 hours after meals, especially after larger portions or known trigger items. Spicy dishes, citrus tomatoes, chocolate caffeine, and high-fat foods frequently make symptoms worse. Body position also matters. Lying flat or bending forward removes the help of gravity that normally keeps stomach contents where they belong, which is why many people notice sharper symptoms at night while trying to sleep. In a horizontal position, acid can more easily wash into the esophagus through the portion of the stomach that is shifted upward. The intensity varies from mild warmth to severe burning that some mistake for a heart attack. Heartburn from a hiatal hernia, however, typically eases with antacids and usually does not send pain into the arms or jaw. If there is any doubt about chest pain or its cause, seek urgent medical care. Listening to your body is the first real step toward relief. A hiatal hernia can masquerade as everyday indigestion, a nagging sore throat, or simple fatigue after meals, but the pattern matters: burning behind the breastbone's sour taste and regurgitation, bloating early fullness chest or upper abdominal pain, hoarseness, trouble swallowing, breathlessness, and most urgently, any sign of bleeding, such as vomiting blood or passing black tarry stools. If you notice these warning signs, especially severe chest pain, difficulty breathing, hematemesis, or melena, seek medical care without delay. For non-urgent symptoms, keep a diary of triggers, meal size, and body position, and talk with a qualified health professional about next steps. The sooner you recognize the signals, the sooner you can protect your esophagus, your lungs, and your long-term health. If this breakdown helped you spot what to watch, support the channel by subscribing, tapping the notification bell, and sharing this video with someone who might need it.